Hi, Allie. I'm Caitlin. I'm a physician assistant student. I know that you just got home to your daughters and your husband. I'm sure you're so glad to be back home. I just wanted to spend a few minutes talking about the goals of care discussion that I'd like to plan soon with you and your family. Do this discussion with all of my patients because it's super important. The goal of this discussion is to see your values and your opinions when it comes to your health care. This kind of things that you'd want versus you don't want. We would typically sit down with you, your family, the clinician, so that could be the doctor, myself, anybody really who has a role in your care. So home health, nursing, your nurse's aide, physical therapy, occupational therapy, and speech therapy. I would even consult with any specialists that you see. So since you had a stroke, I could talk to your neurologist to kind of see where you stand after having your stroke and kind of any goals to really work towards it. We would talk about certain things at this meeting, like end of life planning. So do you want to like code status? So full code, you'd want everything, CPR, medications, or do not resuscitate, where you're like, hey, I don't want CPR. Do not intubate, so that's the breathing tube some people get if they can't breathe on their own. We would talk about medications, so like antibiotics or pain medicines, and really just go over to see if there's any limits to your healthcare management, things that you would not want. So it's really important to do this meeting earlier on than later because that way we know what you want and we would line up our plan most closely with your preferences starting here on out. It also kind of eases families' minds knowing that we're doing what you'd want. But, again, these are heavy topics. So because we would, schedule and talk about it one day, this is an ongoing thing because it may take you a while to realize kind of, hey, I want this, but I don't want that. Or, our minds change all the time, and that's okay. You have that option. So, each time that I'll see you, I'll make it my goal to kind of, keep that ball rolling and continue talking about it because it is super important because it is your life and your health care, and you have the most say in that. So I want to get that scheduled soon, and we can really start thinking about what you want. Thank you.